Wednesday now. Today we are looking at thyroid diseases. Turns out women are 3 times more likely to have thyroid nodules or cancer compared to men. And women are much more likely to have autoimmune thyroid diseases. Albany Med endocrine surgeon Dr. Joshua Chow joins us now with some important information. Doctor, thank you so much for coming in to talk about all of this.
Thank you so much for having me.
Of course, we know thyroid diseases are different, right? They're not all autoimmune. Can you explain the difference for us and some of the risk factors here?
Of course. So I would broadly take thyroid disease into several categories: benign, cancer, and then thyroid nodules themselves, which can be either benign or cancerous.
Okay.
The benign thyroid diseases are actually more likely to be autoimmune. So you have Hashimoto's, which is a underactivity of the thyroid,
right,
which we call hypothyroidism.
Yes.
And then you have Graves' on the other hand, which is an overactive thyroid, which we call hyperthyroidism. So with Hashimoto's and like a underfunction of the thyroid, people tend to feel very fatigued. They have some weight gain. They'll see that their nails and their hair get a little dull. It can also affect both bone and cardiac health. And on the flip side, with Graves' and hyperthyroidism, you have anxiety, feelings of like heart racing, just a very like excited state, and that also can impact fertility, bone, cardiac health, and mood.
We've been showing some of these symptoms as you've been describing, Graves' disease and Hashimoto's here. Why are women more prone? Is it because more women get autoimmune diseases? I mean, why are they more prone to general thyroid diseases?
Of course, that's correct,
okay,
that women tend to have a higher prevalence of autoimmune disease. That actually has something to do with genetics. Because women have 2 copies of the X chromosome, that's also where our immune genes tend to lie.
I see.
And one of those X chromosomes is supposed to be turned off, but about 15% of those genes will escape and then cause this more complicated immune environment. Women's immune systems also tend to be stronger, so it's a double-edged sword. You tend to fight off infections at a better level.
Interesting.
But you also then have those immune systems attack your own tissue. And that's what leads to autoimmunity, and that's the same sort of process that leads to these thyroid autoimmune disease.
Okay, so what can we do here? Because you're a surgeon, obviously, so you intervene when necessary here, and that can be treatment for some, but not everybody, right?
That's correct.
Okay.
So surgery only happens when our medicines don't do the job that they need to for whatever reason. Hypothyroidism, the underfunction, it's 1 pill once a day, managed by an endocrinologist. Whereas the hyperthyroidism, which tends to be actually less common, that ends up being well within my realm. So people will be trialed on these medications. If they don't quite work for about a year, then we think about surgery.
With regard to cancer, depending upon the treatment, people can do very well. Is that fair to say?
That's correct. So thyroid cancer is one of the few favorable cancers. Nobody wants cancer, but it has a 99% survival rate at 5 years in a low-risk thyroid cancer. So it's very treatable. All of these thyroid diseases we have treatments for, and people do really well.
Listen to your body, make sure you talk to your doctor, right?
Absolutely. If you see a lump in your neck, please get an ultrasound. If you're feeling unwell, especially in the range of like 30 to 50 years old, it's as easy as getting a blood test with your primary care physician or an endocrinologist, or even me if you want to come see me. We can take care of that. And it helps us diagnose these diseases that have really great treatments.
Oh, fantastic. Thank you so much for coming and talking more about this. We appreciate it.
Thank you so much.
Especially with so many women affected, right?
Absolutely.
Yes.
Like you mentioned, 5 to 10 times more women will end up having these autoimmune diseases, and up to 3 times more women are affected by thyroid cancer.
Right. We aim to inform here. Dr. Chow, thanks for helping us out. We appreciate it.
Very much my pleasure. Thank you.
Of course. For more resources and to find all of our Women's Health Wednesday segments online, you can go to news10.com, look for Women's Health under the Community tab.